go through with one by one?
Could you tell us how long this meeting's supposed to last? And then we've got an idea of, you know, how much time we'll spend on each item and how much time there'll be for residents to ask questions and have some discussion.
So the officers were saying on average, meetings online are about an hour and a half, Anne.
Thank you.
Okay. Okay, Vicky, Leslie.
Yes, Councillor.
The
first item on the agenda is Mary from Public Health. Mary, are you here?
I am.
Thank you,
Yes,
Mary.
Mary.
I'll put Mary up on the screen, okay?
Thank you.
Thank you.
Yes, Mary.
Mary, if you could just start.
Okay. Well, good afternoon, everyone. So yes, I'm Mary O'Reilly, public health doctor here at Birmingham City Council. Just checking you can hear me clearly?
Yes.
Okay. And have we any interpreters that I need to be mindful of in terms of speaking speed?
No, we don't have any interpreters, Mary.
Mary, could you put your camera on, please?
It is on.
Oh.
Good see you.
Yeah.
I can see Mary.
Yeah, Mary's camera's
That
on.
must be my internet. I can't.
Mary, yes.
There's a number of people I can't see. Okay, sorry.
Okay. So I thought what I'd do is I'd give you a bit of an update on the COVID situation from a sort of citywide regional perspective and zooming into the situation more locally, and then touching on some other information that I think would be of interest to share with you. So the city rate at the moment, so we describe our city rate as a rate per 100,000, and that's really just to make it easy for us to compare Birmingham with parts of Birmingham or indeed with other parts of the UK and the world. So our rate is 88 per 100,000, and that's a reduction in the last 7 days. That's a 7-day rate, so that's a reduction in the last 7 days of about 27%. So that basically means that rates are falling. They have been falling a while. They haven't fallen precipitously, so we'd like them to have gone down further. But it is a massive improvement on where we were, say, at the beginning of January, or even haven't had figures in this range, certainly not since September. So we are increasingly in a good place, but not low enough for us to become complacent. The next thing that I'd probably want to touch on of interest to you would be how we compare with the other cities that we would typically look at, so or other parts of the region. So in the West Midlands, we're not the top, we're not the bottom. The rates are higher in, for example, in Sandwell and Stoke-on-Trent, but they are much lower in Herefordshire. So the range for the West Midlands is 22 to 97. And as I say, Birmingham is about 86. So it's still pretty high for the West Midlands. It's still on comparisons. Birmingham often looks at how it compares with other core cities. So there are certain cities in the country that are described as core cities. Again, the higher ones there would be Leeds and Nottingham. They are in the 90s. We're not far off. But the lower end of the spectrum there would be Liverpool at 59 and Bristol at 47. So I wouldn't say we're middle of the pack there either. We are certainly amongst the higher and in the higher range. So coming down to, so what's the situation within Birmingham, particularly for Handsworth Wood? So out of 69 wards at the moment, Handsworth Wood is in 49th place. So that means that there are 20 wards with lower rates than Handsworth Wood, but there are 48 wards with higher rates. So, lower 1/3 is about where I describe you. What that has meant for us in the last 7 days, because we tend to look at the 7-day period, is that there have been 9 reported cases. Now, for each of those 9 reported cases, we would then have people around them who are identified as close contacts and whom over a period of 10 days or so, we would be advising to watch and see if they develop any symptoms. So basically the virus is still spreading. It's just not spreading as fast as it was previously. Whilst we're on the subject of what happens with our case numbers, also to mention that we've got 15 COVID champions, but I'll come back to the issue of COVID champions later. So just to get a sense of who's affected at the moment. So the majority of cases are in the what I would describe as the typical working age group. So somewhere between 20 and 60. That accounts for 66%. So 2/3 of our cases are in that age group. So we say typically working age. And when we look at how things are being spread, it links to that as well. In terms of ethnicity, again, looking at Handsworth Wood, well, 58%, so almost 2 out of 5 are in the Asian ethnic group, 11%, so about 1 in 10 in the Black ethnic group. But that pretty much represents the demographics of Handsworth Wood. So there should be no surprises there. Just coming back to testing, so I think we must mention testing. So the situation still is, and I will be repeating myself on some of this, but I think it's important. The situation still is that if you have symptoms, you believe you have coronavirus, you go and get a test. Now, the test we would recommend that you get is called a PCR test. We have 2 drive-through testing sites in the city, and we have another dozen fixed sites where you can walk through. You might drive up to them and park, but you actually walk through and get your tests. And that's called a PCR test. That's for symptomatic people. But in addition to that, we have rolled out testing for people who do not have symptoms, but who perhaps because of the nature of their work have to have tests quite regularly. And so we have fixed testing sites. We are introducing an additional dozen hubs. We are working towards, I think we're at 80-something pharmacies at the moment. The aim is to have 100 pharmacies, community pharmacies offering those tests. In addition to that, the government has recently rolled out or offered testing to many more people. So previously, if you were an employer and you had sort of 50 or more in your workforce, you could apply for it. That threshold has been removed, but we recognize that testing is something that the organization would need to run. It's not an easy thing to set up. It's not a simple thing to set up, but it can be done. And so part of what we have applied to do is to be able to offer some support to employers who wish to do that. So particularly the smaller employers who wish to take up testing to protect their workforce. If we're looking to facility whereby we would say, okay, we'll work alongside you for about a month. You would have some training at one of our local testing sites. So you see what it involves, and then you set this up. This is how we're going to need to work to protect all of us going forward. But we recognize that it might be particularly onerous for some smaller businesses. So we're looking to offer that by way of support. So the idea is if you're symptomatic, you go for one type of testing. If you're asymptomatic, you go for the other type of testing. And as many of you will know, schools are reopening and there is a whole load of testing arranged around them. So it's something that the whole of our society is going to do. Care homes have had testing for months, and over time, more and more of us will just get used to testing, what type of test, what it means, and what we need to do. If one does test positive, then you need to isolate. There are some complexities about, well, what happens if you test with this one and you test with the other one. When those situations rise, there is guidance, but if there's confusion, anybody can get in touch with us and we will help walk you through what needs to happen. And if you are required to, if you're contacted, we'd ask you to continue to share that information so that we can identify your close contacts, not all your contacts, but those that you've been close to. So there's a certain distance, certain period of time, and that's cumulative, and identify those people and ask them to isolate. There is also assistance for people who may need assistance to be able to isolate. So we recognize that, you know, that comes with its own pressures, asking people perhaps who have to go out to work not to go out to work, and not everyone will get the pay while they're not going out to work. So there is some national assistance, and there are facilities to help people navigate that and apply for that testing. So that's all the usual bread and butter public health around cases and tests, etc. I touched on COVID champions. So our COVID champions are members of our community. Anybody who lives and works in Birmingham must be 18 or over, and it's live or work. So you don't have to live in Birmingham, but you may be working in Birmingham amongst our community. You can be a COVID champion. And what we do with COVID champions is we offer our COVID champions reliable information. There is lots of misinformation out there. The reason we say our information is reliable is not just because we've produced it, but because we can tell you for everything we put out there what the source is, who's produced it and when. But we also, it's a two-way thing. So we have webinars and we get information back. We're actually seeking information back from COVID champions. What's working well in your communities and what's not working so well with regards to all these things around COVID, so that we can change what we're able to change within Birmingham, but also send messages back up to national government to say this is how it's landing in our communities. So at the moment, we've got 15. We should have 22 for Handsworth Wood to be representative, and that's just representative in number. I know there are other types of being representative, but we need 7 more. So if there's any of you on this call today who is not already a COVID champion, I would strongly recommend it. It's really simple to join up. I can see there's something in the chat already about it. And yes, you do get up-to-date information about what's going on locally, plus a voice, which is really important. It is definitely a two-way conversation. Right. Last thing that I wanted to sort of touch on, and then I'll pause and see if there are any questions. I just wanted to touch on how we're doing with our vaccinations, if I can find the right thing to share. So obviously vaccinations are going on at the moment, and the uptake has been pretty good. As you know, that the criteria, the priority groups for vaccination is nationally determined. That is not a local decision. And the vaccination delivery is being led by the NHS. So I'm giving an update mainly because we've been supporting the NHS in lots of engagement work. We had a series of 5 community events. We do Ward 4, we do all sorts of other groups. I've just come off a call with some of our church and mosque and other faith group leaders. We are answering questions because people need to make an informed choice. So the situation with our vaccines at the moment is we had priority groups and we've worked our way through the first 6. We are now on group 7. So just to recap, for those who don't know, our care home residents, our residents over our community over 80, we also included our frontline social care staff. Then we had people over 75, people over 70, people over 65. Then we had the 16 to 65 in the at-risk group. So those are typically people who would have a flu jab. And at the moment, because the NHS has done so well on cracking on with offering vaccine to people who've taken up the offer, we're now in a position that we're calling out people who are 56 to 59. So they are being encouraged to sign up via the national sites, while in the GP hubs, they are still vaccinating the people who are over 60 to get through as many of those. And the uptake rates are really, really good. But in addition to what's being offered through the GP hubs, and there are 26 of them across the city, we're also offering vaccination in 2 of our mosques, one Gurdwara, and we have a mobile vaccination unit. Now, the mobile vaccination unit needs a minimum of 25 to 30 people who will be there for vaccination. So if you feel that, many people have not left their home in quite a while, and some people are hesitant to go even to, an identified hub for vaccination. If you feel that you've got a community, a cohort of people of at least 25 to 30 who qualify for the vaccine groups that have been called already, and you want to take that up, if you let us know, we'll link that up with the CCG. So I think I'll probably pause there and then take any questions.
I think Narendra raised hand. Councillor Kunar.
Yes, I just wanted to, Mary, thank you very much. That was really, really useful. Just one very quick question. So I know that there's still a lot of hesitancy amongst BAME groups for the vaccination. And because Birmingham is very ethnically diverse, we have a lot of BAME residents. And I know a lot of people have also been doing videos and etc. to encourage people from their own communities. I've done one. I know lots of other councillors have done them as well. Has that been making any difference, or are we still getting a lot of hesitancy? And have we managed to identify any specific reasons why people are still hesitant for the vaccine?
So I'd like to say I think it has made a difference. What I'm hearing is that actually there has been reasonably good uptake in our communities of colour and our various diverse communities. What there still is, though, is a recognition of hesitancy in the community. So we're finding people who've had their vaccine maybe not speaking up and saying that they've had it. So there's a piece of work that we're just thinking about how best to progress to make it okay for people to say, actually, I've had it. So, you get the anecdotal story of somebody who had their vaccine, they posted something on social media, and once they'd said they had it, 6 more people said, well, I had it as well, but I didn't want to say anything. So there's something about also getting us to make it okay for people to say, this is my choice, and I've made my choice, and I've had my vaccine. But the information we're getting, we're still doing work on vaccine hesitancy. We're still trying to understand it. But the uptake, as far as I can see, is much, much better than I personally thought it would be 2 months ago. And I think that is down to the efforts of people like yourself and so many others who have spoken up, spoken out. We're not saying we have all the answers, but we need to have that respectful dialogue so that people can make an informed choice. And I think more and more people have made that informed choice to take up the vaccine. So for every one of you who speaks up and encourages people to take the vaccine, please continue that good work. And I should say, I'm sorry, I nearly forgot, on the issue of the vaccine, when you've had the vaccine, no, we don't ditch the social distancing. We still wear the face covering. All of those things. We're not there yet. We're not out of the woods yet, but it is a really, really important step. At the moment, we're taking the vaccine to prevent people from having those really horrible experiences, people trying to reduce hospitalization, trying to reduce deaths. That's what we're doing with the vaccine in the first instance.
Thank you, Mary. But I like to raise something, before I go to the other respected members. Myself, yes, I've been vaccinated, and I did suffer from the positive myself, and it was very terrible, weakness, so and so. But I'm okay now. I recovered. I had that injection, but I, just send the message through to the community, through to the different channels, to go for it, on my social media, so and so. But uh, like from our cabinet member, the councillor Paulette Hamilton, we receive an email and I keep passing on through to the social media and plus, which is I'm requesting the other to do it as well. But plus, I do that through to the Gurdwaras in Birmingham, even, the nationally, because that my, the social thing, go nationally. But especially we have a group set up, in Birmingham, and wherever, you feel, Mary, you need help, from the Gurdwaras, or I can be helpful. But do you have a breakdown, as we've seen in the media? Majority of the people are from the minority ethnic. Do you have a breakdown? How many are from Afro-Caribbean? How many are from Hindus? How many are percentage from the Sikh community or Muslim community? Do we have a, the breakdown so we can work on these groups?
So there is a breakdown of uptake obviously by the different groups that have been called, and where the information is provided also by ethnicity. The NHS certainly have that information. At the moment, there hasn't been anything that I've seen that has identified any one group to target, or any particular area that we say there is more of a deficit. We all started this when the vaccine came, none of us had it. And whilst Birmingham is very diverse, and we were quite right to recognise from the get-go that we needed to engage with our communities, so far the uptake has not shown a shortfall with any one community that would necessitate action for that community specifically. So I think a whole wide range of messages by all of us is still the approach that we need to take. I've been really pleasantly surprised that, whilst there has been an awful lot of talk and misinformation, there has actually been a lot of people rolling up their sleeve and getting the jab. So I think we need to continue with that general messaging. We need to keep doing what we're doing.
That's fine. Sorry, before I go to the other again, this is a very good. I have done it, from myself, but I'm willing to, if our system or the city need to, I can do that, in a little speech or a little clap, in Punjabi, or some other people from Hindis and the Urdu. So yes, we have it in English, which is we have to be sending message to the public, because we've seen on the social media so much people are, they criticizing, not to have a job. There is no corona, nothing at all. So we have to deal with it. Okay, can I call John Terrell, please? You raise your hand. Can you unmute, please, your mic?
Okay, can you hear me?
Thank you.
Right, yes, thank you. Yes, I know we're talking about multiple occupation later, but in connection with this, it seems to me that multiple occupation is an area which is fraught with problems as far as the virus spread. And I'm just wondering if there's any information about this. I mean, there have been a number of houses left empty through deaths in this street, and they're being taken over and they're being converted into multiple occupation. They're quite unsuitable. But I mean, there's quite a group of people been out there just now who are gathering together, and I'm seeing people that I'm not observing. There are people, seem to be different people coming in and out. They don't seem to be observing anything in terms of distancing and so on. And I'm just wondering if multiple occupation is known about and is a factor. I think it ought to be looked at. I wonder if you have any information about that. Thank you.
Yes, Mary, can you help?
No, so by vaccine uptake by sort of accommodation, type of accommodation, no, I haven't seen data on that. I will inquire, and if I find that there is some, I'm happy to share that.
Right, thank you very much. Be helpful.
Okay. The other thing is, in built-in area, especially inner city, I seen myself. I won't name the roads, and there's a lot of shops. They don't have any control. How many people coming, to the shops? What is happening? Dispensing. No, if the city can do something, please. That's what we require to save the life. To save our residents locally, and they must have some sort of numbering according to the size of their shops. Mary?
Yes. So this is a slightly tricky one. So we have worked with COVID marshals. We have worked with. Oops, sorry, what's in there? We have worked with our COVID marshals, and we have worked with other colleagues who do go out. So environmental health colleagues, for example, do go out, and the feedback we're getting from shops is mixed. Some shops have reported that when they have tried to enforce either numbers or the wearing of face coverings, etc., that they have been they basically received abuse. They've had pushback from the community. I'd like to think that a shop is open and it calls the shots in terms of how people behave when you come into a shop, but they are also there to do businesses and trying to keep their businesses afloat. So part of what we're doing is we're looking to, we've increased the number of COVID marshals who go out. They can support the people in their shops with regards to how people act, what face coverings people are wearing, etc. But we're also looking to develop something similar to COVID champions, but for the employment sector. So they'd be sort of business related as opposed to the general COVID champions who are anybody within the community, because we recognize that actually our workplaces need support. Both the employer and the employees need support to be safe. I think that may be something that is helpful to some of our smaller businesses and shops. But in the first instance, I think it's much more likely to be our COVID marshals. We've just increased the number by 50%. We just funded a 50% increase in that because they can be targeted to a specific area. And whilst they focus on advice and they are linked to colleagues for enforcement, they recognize there's a lot of compliance, but where there isn't compliance, they have a range of approaches to work with, to persuade the public as well as work with the businesses. Does that answer your question?
Yeah,
Or just
okay.
the point?
Okay, I think I got a message. A lot of people want to speak up there, but on later, maybe tomorrow, I'll speak to you over the phone because there is a
Okay.
lot of issue which is I may be able to help, and the other may be able to help.
Okay.
Then there was some hands been raised, but some disappear again. Top of it now, it's Helena France. Helena.
Hello, good afternoon. I just want to go back to the HMO issue. On my street, HMO residents.
Can we finish this health issue?
Yes, yeah, just a minute.
Okay.
HMO residents are approximately 2/3 of the people on the street. Is there any plan to vaccinate or to talk to the providers to make sure? I know in Haringey they are vaccinating homeless people or people in residence as a priority. Is there any such scheme here?
We are looking at what can be offered to a homeless as a whole spectrum. I'm sure you appreciate. So when we say someone's homeless, but we are looking at vaccine priorities at the moment. We are still following the national priority, but that has been mentioned. It is under consideration. With regards to our houses of multiple occupation, throughout the pandemic, we have also provided specific support when there has an outbreak, and when there has been an outbreak, but we've also given advice to any of the landlords, because they're businesses basically, who said, what do we need to do? And we say, this is what you need to do to keep your residents effectively keep your tenants as safe as they can. There's also a website called Germ Defense, which I would strongly recommend. It's useful for single homes, single family homes, but it's also useful for HMOs, because it is not inevitable that if one person has COVID, that the rest of the household has to have it. So we have had situations where one person has had COVID in an HMO, and no, it has not spread beyond that. And no, it hasn't required everybody else on to go into isolation. It does depend on the situation with kitchens and bathrooms and shared spaces. But that's the detail, and we provide that support when there is a situation. But there is also a consideration of what advice, what prevention measures, and vaccination will be part of that.
Thank you. Can I have the last the speaker on this issue, because we're running out of the time. The last is Ruth Lockley. Ruth, are you here?
Oh,
Yes.
hello. Can you hear me
Yes.
now? Yeah.
Yes, we can
I've
hear.
been adding my comments to the side. Hello, Mary. We've met before.
Yes.
Yeah. No, it's just around HMOs. I mean, I know because I do sessions on national test and trace on shifts, and I know how difficult it is when you get in touch with a tenant in an HMO, because you could be putting them at risk when you're asking them to go and name their contacts, because they don't always know who else lives in the HMO. So you could actually be making things worse. And I'm very grateful for Mary explaining that you have been in contact with landlords and you're offering that service to support them to make it safer, because it's a worry for the test and trace teams generally. I know when I'm in contact with other people, that when they speak to somebody in an HMO, what do? You know, because you're trying to give them this definition of a contact, but they don't actually know the other people who live in the house. So I've put all my comments down the side there, but I'm really glad to hear that the council's been able to offer landlords help. Thank you.
Yeah, and just to add to that, yes, we do offer them help. And we have with our COVID marshals, but also with our environmental health colleagues, we have people who have that physical presence. So they will go in, they will take a look at the situation. We're not relying on a case or an individual to tell us, you know, how safe the environment is, and then we will give advice where we need to. Someone mentioned Haringey and vaccination scheme. I have previously worked in Haringey just a couple of years ago, so I know what their HMO situation is like there, and I'm happy to get in touch with them and find out what they've done. But their numbers, they're much smaller patch, much smaller than Birmingham, I think, you know, scale wise. But we need to see what it is they're doing and whether any of that could apply usefully in Birmingham. So I'm happy to look into that. Thank you very much, everyone. I appreciate it. It's been a fair few questions, but I think as has been suggested in the chat, if there are more questions, you know, we're happy to pick those up if you just send those in to me.
Thank you very much, Mary. Thanks, Mary, for your time. I just seen the message, you know, I think Anne Beckett or somebody else, you know, the just message to bring the Neil in, New Discosta.
Yes, there's a message from Anne and there's a message from Neil.
I'm just suggesting what Mary's offered to do, which is very kindly to pick up any surplus questions afterwards. Perhaps that can just be facilitated through the chair, so we don't need to discuss it more now. You know, you getting your email address to us or us emailing in somewhere, but not take out any more time on that now. And thank you very much for your offer, Mary, and your talk.
No problem. No problem. Thank you.
Okay. Can I ask Leslie to on a second item or third item? The next item, please.
The next item is HMOs. It's Deborah Mosley and Stuart Donahue who are here as officers.
Okay, Deborah.
Good afternoon, everyone.
Afternoon, Deborah.
Good afternoon.
Okay. My understanding is that you wanted an update in terms of what we were doing with HMOs, but I'm not sure, is it regarding exempt accommodation or just standard HMOs mandatory licensing? So I can talk about either.
whatever information you have, I think at the end is the hand, please. And
I would suggest you talk about both. For many of us, exempt accommodation, not to plunge into something controversial, but exempt accommodation is HMO accommodation. There are different regulatory frameworks and so on, but both are having an enormous detrimental impact on the neighbourhood, as I know you're both aware. So if you can squeeze in an update on both, because we only really need to hear new information, that would be fantastic. So thank you very much.
Okay.
I agree with what Anne's saying there, because it would also be good to get an update on, obviously we've got officers who have been appointed with the extra funding we've managed to get for dealing with some of the issues. If we're able to get an update as to any outcomes we've achieved or any work that they're doing specifically in our ward, that would be useful.
Yes, that's fine. Thank you very much. Thanks for inviting me. In terms of the mandatory HMO licensing, obviously the city continues to do those. At the moment, we have a small team, so there is a delay in terms of making sure that new licenses are issued within our target, but we're looking at making sure that we can get additional resources to make that happen. Our biggest inquiries that we're having now is regarding exempt accommodation, which is HMO licensing. And you may already be aware that, yes, we've got the money from central government. We had over £1 million. Originally, we were given it to be spent by the 31st of March, but because of COVID, they've now extended that to the end of June, and we're still working with them to see if we can have a longer period. We recognise that the issues that's affecting neighbourhoods can't just be dealt with by one person. So one particular service area. So what we've done is we've got a cross-party working team, which includes people from adults and social care, which would also be looking at the support needs of people in those type of accommodation. We've obviously got our officers who will do the technical aspects in terms of inspecting the properties and making sure they're up to the standards in terms of the health, housing, safety rating standards. And we also have our housing benefit colleagues who are also checking to make sure that the landlords who are receiving the money for exempt accommodation are working to the rules that they says that they were going to. So most recently, I'm sure you've seen it all in the news, we've had green parks have been decommissioned, and that has an impact for the city as a whole, because while it's important that we want landlords to ensure that they fulfill their contract to the tenants, we don't want to get a situation where an organisation is decommissioned and then people are then made homeless. So we again work with the Housing Options Service to make sure that residents can either remain in the accommodation if the property has been decommissioned, or they're found alternative accommodation, which would reduce the likelihood of them becoming homeless and then causing additional demands on the city council for temporary accommodation. So that's where we've been working in relation to exempt accommodation generally. In relation to Handsworth Wood and Handsworth, it's on the border. We had a number of meetings with the Handsworth Wood and Triangular Neighbourhood watch service, and this team from the exempt accommodation team also worked with them. They would give them intelligence about what was happening in the local area, which then gave the staff the opportunity to go in and do the inspections and also work with the local providers in the area to improve the services that they were given, and that's actually been very beneficial. So one of the learnings that we're taking from that is when we transition it across the city where there's a high concentration of exempt accommodation, that's a model that we can use, because we'll take the intelligence from residents and work with that to improve what's happening in the area. So that's the most recent thing. On top of that, sorry, in addition, we have obviously got the Charter of Rights that's been launched, that will be launched recently, and we're looking to ask providers to sign up to that Charter of Rights and quality assessment. And when they've done that, the benefit is that where we know that we have good providers, then we will also use that to make referrals to those organisations. So in a way, we're trying to have an approach which means we're not saying we don't want exempt accommodation, because we clearly there is a need for it in the city. But if we try and just work with those good providers, then it's one of the ways in which we can reduce the type of rogue landlords that we see across the city. So far, we've had Green Parks who've been decommissioned, and there's another potential one, which is Prospect, which I'm aware works quite heavily in Stockland Green and Handsworth, and they're looking to be decommissioned in end of July. Our cabinet member for Homes and Neighbourhoods is working quite closely with MHCLG to see if we can get changes in the guidance and in the regulations for exempt accommodation, but that's an ongoing piece of work. So that's the update in terms of what we're doing with HMOs and exempt accommodation. So I'm happy to answer any questions.
Thank you. I've seen the hand raised by Ryan Muhammad.
Hi, you're right.
Ryan?
Yep, I'm here. Hi. So
Hello.
I just want to speak about HMOs. So as you're probably aware, there's a higher concentration in the Handsworth area towards the Selborne Road area. I live in that area, and I'm just seeing it get worse. I know that you're saying that you're doing all these things in terms of compliance, but from where I'm standing on the street, I live on the street, I'm seeing the area deteriorate. I know that there's been a couple of HMOs, that applications that have been rejected, but the existing ones need to be managed. And there's a lot of antisocial behaviour, there's a lot of rubbish in the area, and I can just go on and on and on. And I know you're saying there's these initiatives, but I think more action needs to be taken promptly. And our residents, we can provide evidence, and you need to just collate it all back and then take some action. Now, I know you said that there's stuff being done, but is it really happening? Are the landlords actually doing what they're saying they're doing? From what I see, they're not doing what they're actually telling you.
Okay, I mean, obviously I'm not going to answer why the landlord's not doing what they say, but what I can say is that yes, we do want to know the information. So if you have any queries, please can you send it to us at the prs@birmingham.gov.uk. I'll put it in the chat, and then that it will be investigated. If it's an ordinary HMO, my PRS service team will do the investigation. If it transpires that it's an exempt accommodation, then it will be sent on to the exempt accommodation team, and they will do the investigation. In relation to planning, I think I'll need to bring in Stuart, because he's the expert on the planning issues and what they can and can't do in relation to that. But if you have any queries, send it to prs@birmingham.gov.uk.
Okay, thank you.
Yeah, so I can add a bit to what Deborah said from the planning point of view. So I think people will be aware that we introduced a citywide Article 4 direction in June last year. Ever since that's been in place, that's meant that the conversion of residential properties to small HMOs now requires planning permission. So planning applications have to be submitted for those proposals now. And the other main piece of work we've got coming forward is that we've got some new planning policies which we're looking to adopt later this year, and they set out the parameters that those decisions on new HMOs will be made against. So one of those criteria, some of you might have heard of it, is that it shouldn't exceed more than 10% within a 100-metre radius of where that proposal is. But there are other criteria as well about family houses that shouldn't be sandwiched between two new HMOs, and also there shouldn't be 3 HMOs in a row, and also there's criteria to make sure that they provide good standards of accommodation and things as well. So So we are looking to adopt that later this year. We're awaiting a report from an independent planning inspector before we can adopt that, but it is due to be adopted later this year, and then that should give us strengthened rules for how we approve or dismiss approvals for or proposals for new HMOs. So that will give us some stronger grounding then to make those decisions against.
Thank you. The next speaker is Helena.
Hi, I've got 3 queries. I live in the same triangle as Ryan. I can collaborate what he says. So I've contacted the PSR. How long should I wait? About 3 weeks ago. How long should I wait before I get a response? Is my first question. My second question is, when you're taking the 10% for HMOs, does that include exempt as well? Because on my street there's 1 HMO, but there's 12 exempt. So, you know, it's sort of, are they taken into consideration? And all the rules that you're putting in place, people should not be sandwiched, no more than 3 in a block. They're all broken in this area. They're already, so it's density happens to be as important, if not more important, than the quality on the particular bit of street that I live on. So how do we stop the numbers increasing, and is there any way of reducing the density? So it's how long should we wait for an answer from PRS? Is there any way of controlling the density of exempt HMOs? And does any planning take exempt into consideration?
Okay. Should I answer the questions on the planning side first, and then I can pass over to Deborah on the PRS?
Yes, no question.
Yeah. So yes, in terms of the 10% within 100 metres, that's just about privately managed HMOs, because the maps, the data that we've been able to map is just for privately managed HMOs. There is a separate exercise which I think Deborah referred to about exempt accommodation and mapping those. So that's a separate thing. But we do, those are the policy criteria about sandwiching and 3 in a row. We can factor in exempt accommodation to that as well. But we also have another policy within the same documents. It's called the Development Management in Birmingham document. So I can provide a link to that in the chat window. There's a second policy within that document called, which is to do with specialist accommodation, and that does look at the impacts of lots of those uses on a certain area. So we can refer to that policy as well for non-HMO, more exempt and specialist accommodation. Well,
Can
I just ask one very quick question? HMOs have to let the residents know that they're applying for planning. Exempt don't. So as residents, we probably don't even know that they're going to be, we've been assured they're going to be family homes, etc., and then all of a sudden they're exempt. What's our channel to argue a case against that, or against them?
yes. So yeah, we set up a web page to explain about that, because it's quite a grey area, unfortunately, in national legislation. What we can do is we can when applicants submit a planning application, we can ask them to demonstrate that they would be exempt from the rules and they wouldn't have to apply for planning approval. So it's up to them to provide the evidence, and that's largely to do with how the occupants live, whether they live as a single household or not. So if they don't live as a single household, then we would require a planning application. But unfortunately, we have to consider it on a case-by-case basis, because of the way the legislation is. We have to require that evidence before we can determine whether an application is required. I'll also include a link to that web page in the chat window as well, so that people can review the information as well.
Okay, can I bring 3 speakers? Then Stuart can, the answer together. Maybe they duplicate, And the first is John Carroll, second is Anne Beckett, third is Councillor Kunda. Can I have a John Carroll first, please? John, we can't hear you. Can you unmute, please?
Yeah.
That's okay. No, you mute again.
Right. Yeah. There's the properties in Selborne, places like that, big properties. I often get planning notice of planning, but there are terrace houses which are falling in. I mean, a lot of people, quite a number of people, passing away and leaving houses empty. And during the pandemic, it seems people are taking the opportunity of acquiring places. And during this period, I've just mentioned that earlier, actually, that they're being taken. Now, I've got no idea, and I can't get out because I'm self-isolating. I can't go and make and speak to people and get to know them. But I mean, they're being taken over, and we've got no idea who's gone there. I've got no information about the status of the property, or we haven't as and so we need to know about each of these. And I say it's terrace houses, and there's a whole block of them which are all becoming HMOs, and they're being altered for 3-4 bedrooms, things like that. And then I'm told on one hand there's a need for there's no need for licensing, and then then it said, oh, well, that's changing. I'm not clear where we are on that at all. Some have exempted themselves, and that's changed over that. It seems somebody's now managing them. We've written to them to ask information. We're not getting it. So we do need to know a lot more about what's happening to our houses in the area. And from a point of view, I've got neighbours, I don't know who they are. I'd like to know who they are and make contact with them. As I say, at the moment, I can't. And as I say, there's a group at the moment out there who are getting together. And again, I can't go and deal with them. They shouldn't be there as it is. But, you know, all these sorts of things need looking at. We need you as officers to be able to give us advice and see if we can get these things regulated. I think if we're involved and know about these, I mean, the fact is people like Helena and other people here are able to give a lot of information to you as officers. I hope that's helpful. I hope we can be helpful to the council in this respect. I mean, you know, I know it's a huge job, but I mean, if we work cooperatively, I'm sure we can be effective and help a lot. Thank you.
Can I bring Anne Beckton, please? Anne? We can't hear you, please. Can you unmute?
Sorry, I beg your pardon. I mean, we do really want to work with the council on this, because it's not in the interest of the council to have some areas go into what is actually becoming steep decline. When I worked in housing years ago, Handsworth Wood was seen as more kind of in a middle range, and there were attempts made to prevent some middle range areas from sinking, if I can put it like that. So, you know, if Birmingham wants to be a city which is great to live in, then we have to do something about these areas that are facing real threat. I just want to ask, really, because I am confused. My understanding of the word exempt, you are the planner and I'm not. So, you know, I bow to your superior knowledge on this, but my understanding is that the word exempt relates to exempt from the housing benefit cap. I'm not personally aware, but I obviously have knowledge gaps to be filled, that the word exempt really applies to something within the planning framework at all. But I will restudy the links that you've sent. My understanding of what you're saying is that exempt accommodation doesn't come into the 10% calculation because you don't have the data at the moment. Do correct me if I'm wrong. My understanding is that the council has an absolute complete list of exempt accommodation because it knows exactly who it's paying housing benefit to above the cap. And then in addition, you've got your database for mandatory licensed properties. So the gap is therefore the small HMOs. I live in a street, as it happens, with small HMOs. and it looks like you've got none of them on your database. And that is really a gap in your policy, because if you want to reduce, the words are to, I think it's to curtail the growth in HMOs, then that gap needs to be filled so that residents objecting to planning applications and the council have a shared understanding of what that 10% constitutes. So do you have a, you know, an intention to fill that gap in your database? And also, and I've raised this with James Fox, would you consider some kind of communication channel? We don't expect to say this, that, and the other are HMOs and you just to believe us, but we are on the ground. We do observe what goes on in these properties. We're a vital source of information. And it would be really good if we could set up some kind of protocol or communication channels whereby we report these into you and you investigate them and you then get them added to the database. Because if you're interested in reducing the amount of HMOs, you've got to be interested in the small HMOs as well. And then just finally, as policy things, would you consider mandatory deconversion when HMOs are emptied? And also, would you consider a selective licensing scheme, because that would also help control the surfeit of HMOs at the moment?
Okay, so yeah, so I can answer questions
answer
on
this
the
one
data.
before I bring it to Councillor Tony.
Okay.
Yes, Joe, if you want to answer the bit that relates to planning, I'll answer the bit that relates to PRS.
Okay. Yeah, so yeah, so yes, we do have the data set which is about privately managed HMOs. As you say, that doesn't include the exempt accommodation, but there is this other piece of work that has been led by our housing colleagues to map out the exempt accommodation as well. So there will be separate data sets which we can compare to each other then. So we, across those two, we will get a comprehensive picture of all those properties. The planning policies that I sent the links to, so the one that I referred to where it says it's 10% within 100 metres, that's within policy DM11 in the second link that I sent to that is focused on that initial mapping exercise that we did for private HMOs, and that was all connected with the citywide Article 4 direction, which covers privately managed HMOs only. So that's why we've only applied that criteria to privately managed HMOs. But as advised, really, the other criteria within policy DM11 does factor in the exempt accommodation, so we can draw from that the mapping exercise to include that then. And also policy DM12 within that document also is focused on exempt accommodation and other types of specialist accommodation as well, to try and reduce concentrations of those and impacts on the character of the area. So we think across the two policies and the different criteria, we think we have got comprehensive coverage really. I think we would be quite open to receiving any suggestions for additions to either of those databases. So if you do have any thoughts, if you've got any evidence to suggest that properties are HMOs or they're exempt accommodation, we can receive those in our planning strategy mailbox. So I'll provide a link to that in the chat as well. I think that was all the points on the planning side. So I don't know if I pass over to Deborah.
Okay, thanks very much. I'll go back. I think it.
Okay. Sorry,
Yeah.
Deborah.
Yeah, I think it was Helene who asked a question about how long does it take to get a response from the PRS. I mean, normally we try to respond within 10 working days, but obviously if you haven't received a response, do you want to write to me and I will get a progress chase on that particular reference, that inquiry that you sent through? But normally it is within 10 working days. I will check and see if it was definitely an ordinary HMO the query was about. If it was in relation to exempt accommodation, I'll speak to the team who manage that and get them to provide a response to you all. So, and yes, we do want to work with all residents of Birmingham, obviously, because we do want people to live in a city that they love and it's a great place to live. And there is a small gap. We have the City Council's currently got a mandatory licensing scheme, which doesn't cover small HMOs, and we recognise that there is a gap there. So what we are doing is that we're looking at developing a PRS strategy, and in that we're looking at things that are bringing in such things as additional licensing, which means that that would take into account smaller HMOs, i.e. between 3 and 4, which will then require an additional license. You also mentioned about, are we looking at a selective licensing scheme? Some of you may already know that at December's cabinet, it was approved that we had met the criteria to look at selective licensing. That's quite a long process because we have to go to MHCLG to get approval for them. If it's more than 20% of the city, that would be subject to this selective licensing, and from our figures, yes, it looks like it will be. So we are going to be going out to consultation, and that will be happening within the next couple of months. So we are actually we are considering a selective licensing scheme. I cannot guarantee that we will get it because it's up to MHCLG once we've submitted our application to give us approval or otherwise. I do understand how you all are feeling in terms of residents, in terms of finding family accommodation being turned into HMOs. And we are just as concerned in the city because you already know the pressures on the city in terms of family accommodation for homeless households. So we have developed a number of incentives, and one of them is a landlord scheme where we try and make it a bit easier for landlords to take on board households who may be on limited income or have to depend on welfare benefits. And this insurance will enable them. They won't have to do any credit checks or reference checks on the landlord. We will cover the deposit, and also the insurance would cover malicious and accidental damage. If it got to the situation where unfortunately the household would have to be evicted, then we would guarantee the landlord up to £1,500 while they're going through. No, £15,000 while over a 12-month period while they're going through the eviction process. And obviously, I know we've got COVID at the moment, but if we go through our roadmap and we get to the end of June, then evictions will be sped up, so it won't be taking a year, but at least in that insurance it covers people, landlords who are going through the eviction process. It's been very popular. The scheme is actually called Help to Rent. It was launched in October last year, and from then till say January, we haven't done the figures for February yet, we've managed to rehouse 75 households, all in family accommodation. Hopefully that's answered the questions that you had.
Councillor Kinder, and it's the last.
Stephen, it's a quick one for you, really. So if you're looking at the, are you looking to introduce a new SPD for exempt accommodation policy? And if you are, then can we not? So I understand that the issue you've got here is you've got one lot of properties that are managed by planning, and correct me if I'm wrong, and another lot of properties that are managed by housing. So I don't understand why we can't connect the two when we're looking at it. But in order to look at, because obviously planning looks at the makeup of an area, the use classes of an area, etc. Can we not bypass that by saying that the SPD takes account of houses in multiple use occupancy? So that will be all encompassing. And for example, on Selborne Road, I have worked with the residents on the application that just went in, and luckily we managed to get it refused for HMO. But they've got lots of houses there where they've got care homes, they've got exempt accommodation, they've got HMOs. So it's a combination, and the cumulative impact of all these properties on this road, which is supposed to be a beautiful tree-lined road with big properties, family homes, but the houses in multiple occupation of the different use classes have made it into a completely different type of area. So in order to bypass the fact that you've got people from different departments managing different properties, can you not, as I'm assuming you're still, if you're still looking at that policy, that you're still in consultation about it, can you not put that tweak in there? Because then that will overcome the issue that a lot of residents are having. So it's any house which is in multiple occupation within a certain, and I think personally, I think 100, is it yards you're saying is not really long enough? I think it needs to be longer than that, but you know, so if you can look at putting that tweak in there, and that will overcome the issue that we're having here.
Yeah. Okay. So yeah, just to clarify, the data that we're looking at. So although there's two different data sets and they're being prepared by different departments, we will consider them together in planning decisions. So it's just really about the responsibility for who's collecting that data. So the exempt accommodation data, we will be referring to that in planning decisions as soon as that's available. The SPD question, the development management in Birmingham document, which I've provided the links to, that's actually been through what's called an examination in public already. So that's where an independent planning inspector considers the text as it is, and the text within that document has to be as we want to adopt it. So because it's reached that stage, we can't amend the text any further, unless the inspector tells us to, basically. So the inspector has to take a view on it, but as far as I'm aware, the inspector's not looking to make any changes to that policy at the moment. But also with an SPD as well, it doesn't have the same standing as it would do within the development management in Birmingham document. So we think that the policies that we've prepared are strong enough to be able to reduce some of these concentrations in future. So the intention of the policies is to prevent new concentrations, but over time, as some properties go back to family uses and things, we can start to manage those concentrations a bit better in the future. But those policies should be in a much stronger position than if we prepared an SPD, which doesn't have the same weight, unfortunately.
So I'm sorry, if I can come back, Councillor Atwell. On that then, so you know, can we look at for Handsworth Wood a neighbourhood planning document? Because yes. I know when I was assistant leader, that was one of the things we were looking at, to give more power to local residents as to how they want their area to look. Yeah. Do you have a neighbourhood planning document? Is that something that we can look at, and what's the process that we can start looking at that?
Yeah, certainly. So so a neighbourhood planning document would have more weight than an SPD, because that's a neighbourhood planning document is considered part of what's called the development plan. So it would have the same status as our development management in Birmingham document. So it would have that strong basis. In terms of how you would apply for that process, it is managed by the different area teams that we have within planning. So I think Handsworth would falls within the Northwest planning team. So I can provide you with the contact details of the team leader for that team.
Could you ask the team leader to contact myself and Councillor Atwell? We'll start the conversations, and then we can work with local residents to try and look at that.
Yes, certainly. I'll copy you into that email as well, so that you can see it.
Can I bring it's a last speaker, please? I know I said the last speaker, but I have another speaker, Nina, here. This is the last speaker on this issue. Yes, Nina.
Thank you. I'm just trying to mute my. Hi. My question is for Deborah. Deborah, you talked about charters, right? And I put a question in there. I just would like to know a little bit more about it. So, who's the charter for, and what's in the charter, and is this some sort of an enforcement? Because I know it's been saying we're going to devise it, and now it's ready. What is it for? Thank you.
That's fine. Hi, Nina. The Charter of Rights is primarily for the exempt accommodation providers, because at the moment, because they're exempt from practically the majority of the legislation that the city council's got available. We can't make them do certain things because effectively they're registered providers, so they have their own rules that they can work with. So what we're trying to get them to do is to sign up to these rights, to say that they will make sure the rights that they will give to tenants, they will make sure they do repairs, they will make sure that the property is up to a certain standard, they will make sure that they do what they're supposed to do as a good landlord, the tenants know how to contact them. If they're providing support, they will say what level of support that they will be giving, and on what basis. So it's for the landlords to sign up to.
Okay.
There was a presentation on it recently, so I will, and this is Guy's area, so I don't particularly want to give the wrong information. He's on leave this week, but when he comes back, if it's available to be sent out, I will make sure that it's sent out to, if I sent it to Neil or Leslie, then she can circulate it to everyone, but I will give a response back to Neil and Leslie about the Charter of Rights.
That would be useful, because then if we as residents know what it's supposed to be, because we the one who look at these properties and how it's being used, so we can help Birmingham City Council as well, can't we, really?
Yes, thank you.
Anyway, thanks for all the speakers. But lastly, can I request to Deborah and the stewards, can't we have a one window service? Rather than there is so many different email, different links, different people have their different view, different information on that kind of issue. If we can have a one window service that could provide it, so they knows what they are dealing for.
I think in an ideal world, yes, ideally it would be lovely to be able to have one sort of mailbox and then everything could be dispersed. But because we have to work to slightly different rules depending on the service that we're in, we've got different legislation that we have to work in. So we then have to have a level of expertise in each area. It then becomes very difficult. But what we try to do to get around that is that we work closely with our colleagues. So if we become aware that an issue is for another service area, we will then make contact with that service area and ask for a response. So you get a combined response, but it's from the two expert areas of the council.
I know, but if we look onto the local residents side, and they confused and they get fed up, email to this, or rent to this, so and so. We need to make it more easy for the local public, and that's from myself and from Councillor Cooner. If you can look into it, through to your department. Anyway, thanks for all of you. Can I, Leslie, the next agenda item, please?
It's matters of local concern, the final agenda item.
Is it possible that do you all need me for anything else? Because I've got another meeting.
Yeah, that's okay. That's fine. You can go. Thanks for your input.
Thank you, Deborah.
Thank you very much. Thanks, everyone.
Thank you, everyone. Thanks.
Councillor, the final item is any matters of urgent concern, AOB. If anybody's got any questions.
Yes, any other business?
My hand's up.
Nina here.
Yeah, I've got a couple. So I've got one with Uplands allotment. If something can be done about the bonfires out of their monthly, whenever they're not supposed to have it, there seems to be that the committee there is out of control. We live near the allotment, so we suffer. Other residents suffer as well. So if something can be done about the allotments, Uplands allotments, Friary Road side as well, because every day there's 1 or 2, 3 fires, and people are taking their own household things to burn there, and the schools affected as well. So that's one issue. The other one is about grass verges, how people are parking their cars and damaging the grass verges around the area, which is then having effect on the flooding as well as ruining the area. So I would bring up fly tipping, but that's something I can deal. But these are the two issues for me. Thank you.
Nina, can you contact him? Have you contacted to the allotment committee?
Well, at the moment we got an environmental health worker investigating, but we want something like you councillors to get involved, please.
Okay, can you call me tomorrow, please, on it?
Phone you or send you an email?
Or send me the email, whatever it is. If you want to call, you can call me, or you can, my telephone is the public, but if you want to send me email, send me the email, please.
Well, I'll send you an email as long as I get response back. Thanks.
I'll try my best. Okay.
Yeah.
The next is the John Carroll, then after that, David White. John? John? Can you unmute, please? We can't hear you. I can see you doing two jobs, ringing the people around and attending the meeting. Can you unmute, please? John, we can't hear you.
Gone mute again. Sorry, I had muted.
Okay.
Okay now. Right. It's a future agenda, and it's concerning GP surgeries, because I mean, 40 in London, a US company just purchased 49 GP surgeries with no comment from Hancock or anyone else. The thing about that is, though, that the CCGs have allowed this to happen improperly without any consultation or notice. Now, I'm concerned because, you know, in Birmingham, one of the people, Centene is the American company, and the British thing is called, let me see, Uprose. And one of our top doctors, who was the chair of the CCG, Sandwell and Birmingham CCG, moved to it about a year ago and became a director. And his name is on this report as having been involved in it. So what I've been asking the practice, and the doctor there doesn't know anything about any plans for it being taken over. But I think we should know, and we should be clear from the CCG that there are no plans for doing this. And if there are any plans of any sort, then we should be consulted, told and consulted in good time, because that's our right. And I think, you know, we say every day we're saving the NHS. Well, this isn't saving the NHS. And the worry is it's people inside it, or who've been inside it and always thought of as champions of the NHS, are taking the opportunity and undermining the NHS in a big way. And, you know, these people have been trained as doctors by us, by funding from the public purse, and they're doing this sort of thing. And I think that we should know if there are other people. It's like in Parliament, the revolving door. You've got people with a lot of experience, and they get put into high places, and then they're seen as ripe for big companies to take over. So it seems to me that we do need to be watchful and make sure that our GP surgeries are kept within the NHS service.
Thank you, John. Can I bring that David Wade in, please? David?
Good afternoon. You're right. You can hear me okay? Yep.
Yeah.
Okay. Yeah. I'm just asking someone to have a look at our street lighting on Somerset Road. I know I've mentioned this a good while ago, and I believe someone said something about every 10 years or something that things get replaced or something, the street lighting. But we've got various care homes and other homes for different needs, and obviously a few HMOs and things like that. But the lighting in particular is very poor. I know, like Devonshire Road and other places have got these LED lightings and things like that, and which makes it a lot more visible. I'm just wondering if particularly we can do something, especially on our road, and for the lighting, because a lot of our residents are asking, you know, saying that it's very poor quality down there, and we've had quite a few different crime situations. We had one over the weekend, a drug bust opposite where I live, and they wanted evidence, and it's quite poor some of the visibility and certain things. I'm just wondering if is anything that can be done to improve the lighting, especially on that road. I don't know. I just thought I'd ask.
Thank you, David. Can I bring there Rohin Mohammed, please?
Can I just respond to David? David, happy to send an email to find out when the proposal is to look at street lighting, because there's supposed to be a cycle. So it used to be, the contract used to be with Amy before. The contract is now with a company called Kia that's supposed to maintain the street lighting, the roads, the streets, pavements, etc. in Birmingham. So what we can do is we can fire off an email to try and find out when Somerset Road is supposed to have the street lighting replaced on that rota. Yeah. If you want to send me an email, then I have an email to respond back to you on. Otherwise, I haven't got your email. So
okay, I'll do that.
Send me an email about it. I can then respond back and copy you into the email.
Yeah, I appreciate that. Thank you.
Can I bring there Rohin Mohammed, please?
Yeah, thank you. Mine's about parking. Again, it might be linked to the HMOs. So on Talbot Road, there's hardly any parking. So would you look at introducing maybe permits? I mean, even like our neighbour, he's got a drive. We're in the process of getting a drop curb, but his drive is always blocked in. And so is there anything that we could do possibly about parking? And it's becoming a bigger issue as well. It's just not on Selborne Road. I know on my mother's road as well, towards Handsworth. She hardly gets any parking on that road as well. But yeah, so maybe we could do something about that. Thank you.
Ryan, I understand the issue, the parking we have. Used to, years back, we only had 1 or 2 cars on the road. Now, every household, how many people can drive? They have a car. So that's the issue. We're having a issue, parking issue. We're having a word, the grassword parking, so and so. Yes, we keep discussing it. Anyway, can I bring the Richard Hatcher in, please? Richard?
Yes, thank you. Can you hear me?
Yes, how are you?
Good, I'm fine, thank you. I hope
Carry
you are too. It took me 40 minutes to get into this meeting. I don't know why. I hope other people haven't had that problem. And I don't know whether there was any information at the beginning of the meeting about how regular our ward forums will be in future. But can you tell us when the next ward forum will be, and if the intention is that they will
We will have a meeting. We will have a meeting, continue the meeting, but I don't have a date with me as a present or with the Councillor Cooner and the Leslie, the officer I have to discuss, and we will announce soon.
Is it your intention that there will be 6 meetings a year
yes,
in line with council policy?
It is. Depend what we got resources from the city, but our attention is yes.
Good, excellent. Thank you.
Can I bring an again Eugene? Eugene, who?
Eugene.
Hello.
Hello.
Can you hear me okay?
Yeah.
Okay, thanks. Just 2 things. One is regarding planning breaches. For those who have applied for planning permission for extending their houses or putting up buildings in their gardens. I need to know who I need to complain to regarding the planning officers not taking charge of enforcing the breaches of planning. Is there any way of contacting someone regarding the complaints regarding these officers?
I think you can complain to the planning department if you think somebody is building illegally.
No, no, the idea is,
please.
I've complained to the planning department. They've put me onto the planning enforcement officers. The enforcement officers have gone out and looked at my complaint the resident has actually has breached the planning conditions, and yet the officers are not taking this seriously and enforcing these conditions. So I need to know, what do I do? Who do I complain to regarding the planning office, the officers not enforcing correctly?
It is complicated. If you have complained it and the enforcement came to look into it, and if you have a particular property, 1 or 2 or 4, whatever, send an email to myself and Council Cooner. We will make an inquiry, what is happening. But sometime there is a permitted development, and they can build it. And sometime we all have experience. I think similarly, Council Cooner have the experience. Some people, they do have the planning when approved, and then some people complain it. If the planning has been approved, nothing we as a councillor can do it. But I know some people are happy, some are not happy. If you have an issue with the enforcement, anything, please email us. We will look into it.
Okay, it's not that, it's really the enforcement officers not taking the
I think.
Okay.
I think.
Yes, I
Councillor
will do that.
Councillor Cooner wants to say something.
So the normal process is that if you feel that someone has breached a planning application, they're not building in compliance to the planning application that's been approved, planning enforcement officers would then come out and check the site and ensure that it is whether or not is compliant. If it isn't compliant, they will then take further action. If they come out and they check and it is compliant, then they won't take further action. So it could well be that they've come out, and although you may feel that it isn't compliant, it might be compliant. So either you can, so the chair of the planning committee, McCarthy, so you could, if you wanted to escalate it within the planning department, you can email Councillor Karen McCarthy. But it could well be that the reason they haven't taken any action is because although you might perceive it's not compliant, it is compliant with what's been approved.
No, I've actually looked at the documents. I've got copies of the approval, and it comes with conditions, and these conditions are not being applied with. And the planning enforcement officers are not taking actions. And I've got emails after emails which I've sent, and they're still not taking actions appropriately.
Okay. So you can, if you want to escalate it within the planning department, the chair of the planning committee is Councillor Karen McCarthy.
Okay, thank you.
Thank you.
Okay, we are running out of time. We've got only 1 minute. Can I bring the last speaker?
Councillor Atwell, can I just respond to, there's a young man from Selborne that asked a question about parking permits.
Okay, can I bring the Ruth first? Ruth Lockley, then Councillor Cooner. Yes, Ruth.
Yeah, hi, thanks. I mean, I think there's probably not enough. Hello, can you hear me?
Not clearly, Ruth.
We can't hear you.
Can you hear me now?
Yes. I can hear you, yes.
Okay. Yeah, I mean, it was something I raised on the internet. You haven't got time to deal with it today, but I think that there may be some Section 106 monies to be spent, which would be really good news. And over the border, they've been having big discussions about their 106 monies. And I was also wondering about, the small pot monies for this year, whether there's going to be any discussion what they're spent on. I would also just back up Ryan's thing about the parking. It's this is onto Endwood Court Road as well. There's currently a guy who, for the last 6 months at least, who doesn't live on that road, has been using it to park 2 car transporters. He runs his business from off that road. He has left a derelict car on one of them for the last 4 weeks, and the poor elderly couple, who are lovely, who live at that end of the road, have to come out every day out of the front of their house and see derelict cars sitting on 2 transporters, and there doesn't seem to be anything that anybody can do about it. And it's it's awful. I mean, they did at one point start to park it on the end of Wood Lane, and I think one of the residents managed to get him moved off there because he was breaking parking regulations. But it seems to me wrong that somebody can run a business off a residential road and just leave derelict cars sitting on a car transporter, because it's horrible. It's really horrible. Yeah, so I just back that up, but it's the Section 106 monies. It's what we, you know, if we're having sort of ward plans and nice things maybe to look forward to, could that be discussed, or could we be circulated with the knowledge of if there is any 106 monies? Thank you.
I know you messaged me and I answered to you.
Yeah.
And we will discuss it in the next meeting. I will request to Leslie if you could update us in next meeting or email me so we can circulate it to the relevant people who want to know. And now to answer on a parking, I'll bring the Councillor Kuhner in. Councillor Kuhner.
So Ryan, you asked the question about getting residence permits. So this is something that I looked at for another road a while back, and I was told that the criteria for getting residence permits is if it's near a big shopping centre or like a football ground or something like that. Apart from that, it's very, very difficult to get residence permits just on a general road. So I just felt that your question wasn't responded to fully. So I just wanted to highlight the fact that, yes, I understand the concerns. And Ruth, the concern that you've also raised about the repair lorry that's left on the end of Endwood Court, I've actually emailed Highways about that, because that gentleman has contacted me to see if there is anything to do that we can do about that, if he's causing an obstruction. I know it's quite unsightly. I'm dealing with something similar on another road as well, where people are leaving on Inglenook Road. They're leaving cars which they're repairing on bricks and stuff while they're repairing it, and caravans and all sorts, and it's causing issues. So in regards to that, I have put an inquiry in, but I'm not sure what I can do about that. If they've got road tax, they shouldn't be parking it there, because like you say, they don't live there. I believe they live in the flats, etc., further down the road. So I have put an inquiry in. I don't know what I can do about it, but I'm looking into it at the moment.
Okay, thank you very much for everybody, especially Leslie and our technical team, all the officers and all the attendees, all the local residents, so everyone. Thank you very much. I'll see you in the next meeting, and have a nice time, and be safe and keep safe yourself, and make sure you keep the others safe as well. Look after your family and neighbors. Thank you very much. Thanks for everybody.